This is the manual muscle test for horizontal adduction of the shoulder. The muscle being tested is the pectoralis major. The pectoralis major is a rather large muscle that has muscle fibers that run in two primary different directions. Therefore, the muscle is broken into two different heads which are tested individually. The fibers shown in red represent the sternal head of the pectoralis major. Because of the direction of the muscle fibers, it tends to pull the arm across the body and down at the same time. To test this portion, we start with the arm abducted to 120 degrees. The fibers of the clavicular head run in a different direction. When contracting, they tend to pull the arm up and in. Therefore, to test this portion of the muscle, we start with the arm abducted 60 degrees. When testing for grades 3 and above, the pectoralis major is tested in three different positions. The patient is placed in supine with the elbow flexed and the shoulder abducted. To test both heads simultaneously, the shoulder is abducted to 90 degrees and the clinician directs their force directly away from the patient. To test the sternal head, the arm is abducted to 120 degrees, the patient pulls the arm down and in, and the clinician's force is directed up and away. To test the clavicular head, the arm is abducted to 60 degrees and the patient is instructed to pull their arm up and in. The clinician will then direct their force down and away. For each test, if the patient can hold against maximum resistance, they earn a grade of 5. If the patient can hold against strong to moderate resistance, they earn a grade of 4.
Alright. Hold this position. Don't let me move you. Relax. Lift the arm up and in. Hold. Don't let me move you. Relax. Pull the arm down and in. Hold. Don't let me move you. Relax.
To earn a grade 3, the patient must complete full active range of motion without resistance. If appropriate, the shoulder may be tested for grade 3 in all three positions.
Bring the arm across the body. Relax. Lift the arm up and in. Good. Relax. Pull the arm down and in. Relax.
When testing for grades below 3, there's no need to identify the individual portions of the pectoralis major. The patient is positioned in supine with the elbow flexed and the shoulder abducted to 90 degrees. The clinician supports the weight of the arm with one hand and palpates the pectoralis major with the other. If the patient is able to complete full range of motion with the arm supported, they earn a grade of 2. If there's no movement but muscle activity is palpated, the patient is given a grade of 1. If there's no palpable muscle activity, the patient earns a grade of 0.
Pull the arm across the chest. Relax.